expect to be there as standard. But this bill is, of course, so much more than just access to education, health and care plans. That is why the provisions in this bill are so important. It seeks to address challenges throughout life for people living with Down syndrome by ensuring that that guidance is there and that relevant authorities must take account of it when designing and delivering those services. And this really, again, is the point I want to emphasise. I said earlier that accessing services can be a struggle in the first place, but even when services are provided, they can be far from appropriate and to the needs of those that they are supposed to be supporting. I've come to, of course I would happily give way.
Thanks to the member for giving way. I think he's raising a number of really pertinent points, because it's not just about the dental appointments, the vaccinations and everything else that goes with what the movement bill is trying to achieve, but it's changing these attitudes to make sure that when you're handed that bundle, it's at the maternity hospital, it's not just a bundle with a leaflet. You know, it needs to be that the schools, the support systems are actually have got it in their minds that this is just another child that deserves their attention, deserves their professionalism. And, you know, I think through his speech he's making that point exceptionally well.
I'm very grateful to the Honourable Member for his intervention, and I think I can highlight that case in even more detail. One of the really shocking things that I found through constituency surgeries is that I often have parents come to me with copies of their children's education, health and care plans, and they have often got incorrect names of children within those plans, and many of them are quite obviously copy and pasted. They are templates. There's just a standard form which is just adjusted very, very slightly whenever a new plan is issued. That isn't the way to cater and deliver services, not only for children living with Down syndrome, but frankly any child who needs access to an education, health and care plan. The whole point of that piece of legislation and plans like this, and the point of this bill, is to make sure that services are properly catered to the individual, that they reflect the needs accurately, and that is why I feel so passionately about supporting this bill. Because it will give parents and it will give people living with Down syndrome the legal backing of the state if they do need to go into battle. And I do really support the government in its approach to consulting with those service users and indeed those who will be delivering these services when it comes to designing that guidance. So a final point I would like to make as well, agreeing with my right honourable friend, the member for North Somerset, is that it is vital that throughout the passage of this bill that the issue of redress is also taken properly into account, so that we have that by the time it becomes legislation. I'd just like to put that on record. But I'd just like to reflect that the families that I spoke to at Get On Downs and the testimonials I'm sure we've all heard from our own constituents and families up and down the country who have been campaigning so hard to secure passage of a piece of legislation like this have been incredibly heartfelt. I've heard over and over again what a difference this bill will make to their lives, or indeed what it would have meant to them if they'd had this kind of legislation in place when they were struggling. When I met Charlotte and the families at Get On Downs, they said they wanted to be listened to. And we have the opportunity to listen to them today. So I hope colleagues will join me in voting for this bill, start the journey to putting it into law, and help better the lives of the thousands of people living with Down syndrome in our country today.
Sally Ann Hart.
Thank you, Madam Deputy Speaker, and I also welcome the Right Honourable Member for North Somerset for introducing this very important bill, which, when passed, will lead to the establishment of a national strategy to improve provision and outcomes for all those living with Down syndrome in England. The bill will legally recognise people with Down syndrome as a specific group, ensuring that they are protected along with other minority groups. Current government policy focuses on recognising and addressing the inequalities and premature mortality of people with learning disabilities. Policy doesn't differentiate between different parts of the population, except where there is clinical justification. And we've seen during COVID that people with Down syndrome are particularly at risk from that disease and classed as clinically extremely vulnerable. The aim of this bill is to ensure that people with specific challenges caused by Down syndrome are given the right support by local authorities which are to be given guidance on appropriate steps to take to meet specific need. And this does build on the government's stated commitment to improve outcomes for people with a learning disability. It is important for children with Down syndrome to attend mainstream schools, but still too many are sent to special schools. It does vary between local authorities. When I was in my early teens, my mother spent a couple of terms as a supply teacher at a special school in Hexham, Northumberland. She absolutely loved it, loved her pupils, loved teaching them. She found it so rewarding and such an honour to teach children with a variety of intellectual and learning disabilities. We were lucky, as her daughters, that she had the initiative to get her daughters in to visit from time to time, opening our eyes, our minds, hearts and souls to those who may not be quite the same as us, but who are still very much loved and valued members of our society. It also taught us that people are different, and this is what makes us all so special as human beings. We all want equal opportunities for people to believe in us as individuals. This bill will place a requirement on every school to meet the needs of pupils with Down syndrome, giving them a choice about which school to go to. As society, perhaps a bit too slowly, becomes more inclusive, life is changing for people who have disabilities, including Down syndrome. Mainstream education is becoming more common, and this has brought considerable benefits to all children. There is no doubt, however, that it can be challenging at times to include a child who has Down syndrome in the classroom, as it can be with any child with a learning disabilities, and teachers would need training to better understand the condition, including helping pupils with Down syndrome to improve their speech and language and helping them to reach their optimal communication, as well as ensuring that all children can access the curriculum. I have so many parents that complain to me in my constituency that they have to fight sometimes for an education and healthcare plan, and it is shocking that there are children with Down syndrome, which is a well-known disability, learning disability, with a well-known need for good early educational intervention without a full-time ECP, and some even don't have them at all. Not having a plan means that the right provision or support system is not to be available, or even have no support whatsoever. Research shows that mainstream schooling has better outcomes for children who have Down syndrome, and that students with Down syndrome gain academic, social and behavioural advantages from being educated with their typically developing peers in mainstream school. With appropriate support and accommodations, students with Down syndrome can benefit from mainstream schooling, and inclusive education has benefits for all students. My daughter, who's now an adult, had the joy of going to primary school with a classmate who had Down syndrome. She enriched her classmates' lives, and as they all got older and started to notice that she was different, they did not treat her any differently. To them, she was her, and absolutely perfect as she was, someone they had happily grown up with. As they got older, it also helped them to be more caring and considerate. Unfortunately, their friend was not allowed to stay with her friends beyond middle school. This was not only sad for her and her family, but really was a loss for her friends and the school's loss. I also want to just briefly highlight the lack of job opportunities, as has been highlighted, for people with Down syndrome. There are around 40,000 people with Down syndrome living in the UK, and only 6% are employed. 6%. Think of the isolation and loneliness of the 94%. I want to take this opportunity to thank Littlegate Farm and all the work they do in helping and supporting people with learning disabilities near me. This bill will aim to improve employment rates for adults with Down syndrome, and we need to unleash the potential of everyone, including people with Down syndrome, to give them the opportunity of showing us all what they are truly capable of and ensuring they get the same chances as everyone else. This is about levelling up individuals. It is right and just to give people with Down syndrome recognition of their specific needs and give them the dignity of a human person. It is never too late to be who you want to be, and never the wrong time to do the right thing.
Yeah. Thank you. I am just delaying for a few seconds so that we can have a perfect transition to 11 o'clock, at which point, order. Under the terms of Standing Order number 11.4, I'm interrupting proceedings for a ministerial statement. I call the Secretary of State for Health, Sajid Javid.
Thank you, Madam Deputy Speaker. With permission, I'd like to update the House on COVID-19, but before I begin, I want to wish the Shadow Secretary of State well as he recovers from COVID-19. Madam Deputy Speaker, over the past 48 hours, a small number of cases of a new variant have been detected on our international genomic database. I want to reassure this House that there are no detected cases of this variant in the UK at this time, but this new variant is of huge international concern. The World Health Organization has called a special meeting this morning, and that meeting is taking place right now. I want to update the House on what we know so far, why we're concerned, and the action that we are taking, although I must stress that this is a fast-moving situation and there remains a high degree of uncertainty. The sequence of this variant, currently called B11529, was first uploaded by Hong Kong from a case of someone travelling from South Africa. The UK was the first country to identify the potential threat of this new variant and to alert international partners. Further cases have been identified in South Africa and in Botswana, and it is highly likely that it is now spread to other countries. Yesterday, the South African government held a press conference where they provided an update on what they know so far. I want to put on record my thanks to South Africa, not only for their rigorous scientific response, but the openness and transparency with which they have acted, much as we did here in the United Kingdom when we first detected what is now known as the Alpha variant. Madam Deputy Speaker, we are concerned that this new variant may pose substantial risk to public health. The variant has an unusually large number of mutations. Yesterday, the UK Health Security Agency classified B11529 as a new variant under investigation, and the Variant Technical Group has designated it as a variant under investigation with very high priority. It's the only variant with this designation, making it higher priority than Beta. It shares many of the features of Alpha, Beta, and Delta variants. Early indications show this variant may be more transmissible than the Delta variant, and current vaccines may be less effective against it. It may also impact the effectiveness of one of our major treatments, Ronapreve. Madam Deputy Speaker, we're also worried about the rise in cases in countries in Southern Africa, especially as these populations should have significant natural immunity. In South Africa in particular, there has been exponential growth, with cases increasing fourfold over the last 2 weeks. In Gauteng province, which includes Johannesburg and Pretoria, some 80% of cases, when tested with a PCR test, have shown something that is known as the S-gene dropout, which we associate with this variant. So while we don't know yet definitively whether the exponential growth in South Africa is directly associated with this new variant, this PCR test analysis does indicate that there could be many more cases of this new variant than just those that have been sequenced so far. So, Madam Deputy Speaker, even as we continue to learn more about this new variant, one of the lessons of this pandemic has been that we must move quickly and at the earliest possible moment. The UK remains in a strong position. We've made tremendous gains as a result of the decisions that we took over the summer and the initial success of our booster programme. But we're heading into winter, and our booster programme is still ongoing, so we must act with caution. So we're taking the following steps. Yesterday, I announced that from midday today, we're placing 6 countries in Southern Africa on the travel red list. These countries are South Africa, Botswana, Lesotho, Eswatini, Namibia, and Zimbabwe. Anyone who is not a UK or Irish resident who has been in one of these countries in the last 10 days will be denied entry into England. UK and Irish residents arriving from these countries from 4 a.m. on Sunday will enter hotel quarantine. Anyone arriving before those dates should take PCR tests on day 2 and day 8, even if they are vaccinated, and isolate at home along with the rest of their household. If you've arrived from any of these countries in the last 10 days, NHS Test and Trace will be contacting you and asking you to take PCR tests. But please, do not wait to be contacted. You should take PCR tests right away. We've been working closely with the devolved administrations on this, and they will be aligning their response. In recent hours, Israel has also taken similar precautions. Madam Deputy Speaker, I wish to stress that we're working quickly and we're working with a high degree of uncertainty. We are continuing to make assessments, including about those countries with strong travel links to South Africa. And we are working with our international partners, including South Africa and the European Union, to ensure an aligned response. But this variant is a reminder for all of us that this pandemic is far from over. We must continue to act with caution and do all we can to keep this virus at bay, including, once you are eligible, getting your booster shot. We've already given over 16 million booster shots. The booster jab was already important before we knew about this variant, but now it could not be more important. So please, if you are eligible, get your booster shot. Do not delay. Madam Deputy Speaker, we've made great progress against this virus, progress that we are determined to hold on to. This government will continue to do whatever is necessary to keep us safe, and we've all got our part to play. I commend this statement to the House.
Alex Norris.
Thank you, Madam Deputy Speaker. I thank the Secretary of State for advanced statement and for his kind words about the Shadow Secretary of State, which we would all share on this side of the House too. Now, we have been critical of the government in the past for taking too long to protect our borders from new variants, particularly when Delta was left to run free. So we are glad to see swift action today. Adding these countries to the red list is the right call, and we support it. I wonder if the Secretary of State might explain why it's these specific countries added and not the wider group where cases of this variant have been detected, and whether the addition of further countries is under active consideration over the coming days, but that perhaps in the meantime we might at least, for countries not on the red list but have cases, require PCR tests on arrival rather than lateral flow ones. We have made, as the Secretary of State says, great strides in getting people vaccinated in this country, but we've always warned that no one will be safe until everyone is safe. And it is regrettable that when we offered plans to the government earlier around global expansion of vaccination, those weren't taken up. And today's news does reflect a failure of the global community to distribute the vaccine, with just 5.5% of people in low-income countries being vaccinated. So could the Secretary of State tell us about the work he'll be doing with his counterparts in affected countries to make sure that they have the vaccines and the infrastructure to deliver them? And can he give us the assurance that our cuts to aid that we've made in this country will not affect that? And would he share with us our regret that we had to destroy 600,000 expired doses of the vaccine in August, and what we're doing to make sure our stockpiles get to other countries who need them? Turning to testing, Madam Deputy Speaker, earlier this month capacity went down significantly, with members of the public reporting that their local centres had closed. Would the Secretary of State reassure us that testing still will be an integral part of our approach, and can he take this opportunity to refute the rumours that test and trace will be scaled down further? This is also a reminder, Madam Deputy Speaker, that we need to go further and faster with vaccination at home. Children's vaccination rates remain low. The progress on the booster is, of course, welcome, but we know to get there by Christmas we need to go even quicker. And there are of course, huge pockets of the country where significant numbers of people remain unvaccinated. 40% of people, for example, in Nottingham, 38% in Wandsworth, 30% in Bolton. And the message that Secretary of State had for those people today, I think, was a very important one. Because this is a reminder that COVID has not gone away. So will the Secretary of State make commitments to fix sick pay, which is still necessary 19 months on? And will he go further to ensure that public buildings, schools and businesses have the support they need? And surely, Madam Deputy Speaker, we must now revisit cost-free measures such as mask wearing in public spaces. Madam Deputy Speaker, to conclude, this is a sobering reminder of the challenges that this pandemic brings. And we must meet this moment as we have throughout the last 19 months, by pulling together, by looking out for each other, and in that British spirit of doing what must be done. Thank you.
Secretary of State.
Madam Deputy Speaker, I'm pleased to respond to the Shadow Minister. His first question was around the countries, the 6 countries that we have decided to put on the red list from midday today. We are going by primarily about where this new variant has been detected at this point, and that's been confirmed in 2 countries in Southern Africa, and that's South Africa and Botswana. We've included the 4 other countries that I mentioned earlier in Southern Africa as a precaution, and I think the Shadow Minister won't be surprised to know that we are keeping this under review, and there's very live discussions going on around whether we should and when we might add further countries, and we won't hesitate to act if we need to do so. In terms of the vaccine donations to developing countries, the Shadow Minister is absolutely right about the importance of this. He will know that the UK has, for a country of its size, has done far more than any other country in the world. Already over 30 million donations. We are absolutely committed to our 100 million target, and we will continue to work bilaterally with countries, but also through the COVAX alliance to get out more vaccines to the developing world. Testing remains a hugely important part of our response to this pandemic. It's playing an incredibly important role, and that will continue for as long as is necessary. And then lastly, on the vaccinations, of course, that is the primary force, the primary form of defence in our country. In one sense, we are fortunate with such a high level of vaccination. Over 80% of people over the age of 12 have been double vaccinated, 88% at least a single vaccination. That's one of the highest in the world. But we need to go further, and we need to go even faster. And it is great news that our booster program at over 16 million jabs across the UK is the most successful in Europe. Now, I believe over 26% of the population over the age of 12. But we would want more and more people to come forward as soon as they're eligible. And I can't stress the importance of that enough. And today, as he said at the end of his remarks, it is a sober reminder that we are still fighting this pandemic, and we can all play a part.
Dr. Liam Fox.
Deputy Speaker, the viral mutation process of genetic drift depends on the number of times a virus gets to replicate. So the wider the spread geographically and the longer that it goes on, the more viral replications will occur and the more chances there will be for mutations. So there is a need to redouble our efforts to vaccinate populations right across the globe. My right honourable friend mentioned the potential increased transmissibility of this virus, but there's another important element, which is the severity of the illness produced by a variant. What do we know about it so far, and the potential, therefore, for impact on the health service?
Secretary of State.
And Deputy Speaker, as always, the analysis that provided by my right honourable friend is absolutely correct. In terms of the severity of this new variant, I'm afraid we don't know enough yet. From what we can tell from let's call it a desktop analysis, given the number of mutations that have been identified, you double those that were there for the Delta variant, it does indicate that there's a possibility that it might have a different impact on an individual should they get infected. But as I said earlier, there's a lot we don't know about this, and we are working with our international partners to find out more.
Rachel Maskell.
Thank you. Madam Deputy Speaker, I thank the Secretary of State for his statement today and also for emphasising the importance of vaccination. However, his statement does make clear that we are seeing new variants and the risks still remain, and therefore taking further public health measures is really, really important. And therefore I ask him again whether or not he can give very clear leadership around ensuring that face coverings, social distancing and high hygiene are instituted, as well as better ventilation, because these measures do make a difference, as we have seen throughout the last 2 years.
Madam Deputy Speaker, the Honourable Lady makes a good point about the need to follow guidance and the rules that are currently in place. The Plan A policies that we put in place, they remain the policies I think that we need at this time, but she won't be surprised to know that we do keep this under review, and if we need to go further, we will.
Sir Charles Walker.
Honourable gentleman opposite, the shadow spokesman for Her Majesty's opposition, mentioned the number of people who are unvaccinated. Please, Secretary of State, can we bring a nasal vaccine to market? Stage 2 trials are proving to be really, really good and positive with high rates of efficacy. If we've got to throw the kitchen sink at this, I cannot understand why we are not making nasal vaccines available. That will increase the uptake of vaccination in this country and across Europe.
Secretary of State.
My honourable friend is absolutely right to point to the importance of the continued importance of the vaccination programme, and there are some 5 million people in the UK that haven't even received a single shot of any type of vaccine. He's right to talk about the importance of the methods of delivery of a vaccine, and as he's mentioned, there are trials of nasal vaccines, but I'm sure he'll understand until such vaccines are approved by our independent regulator, we would not be able to pursue them.
Pat McPadden.
Thank you, Madam Deputy Speaker. I'd like to thank the Secretary of State and the NHS and everyone who is responsible for the booster programme that's helping to protect us as we enter the winter months. But isn't one of the lessons of the news that he's announced today that if we don't tackle the enormous vaccine inequality around the world, we're going to continue to be exposed to new variants of this type? In Africa, for example, just 6.6% of the population have been vaccinated. Now, of course, it's every government's first duty to protect its own people. Everyone understands that. But does the Secretary of State agree that the United Kingdom and other rich countries in the world must do more to ensure that surplus doses that we don't need are distributed to countries that do need them, rather than not being used and ultimately, in some cases, being destroyed?
Secretary of State.
Madam Deputy Speaker, I very much agree with every word of the honourable gentleman, especially around the surplus vaccines, and that is exactly what we have done. Whenever we have identified vaccines that we may not need, we have offered them either bilaterally or through the COVAX programme, and we will absolutely continue to play our role, but also, very importantly, we will continue to urge our international partners to do all they can as well.
John Lamont.
Thank you very much. I commend the government for the speed at which they have taken this decision. I also welcome the fact that the Scottish Government is following suit, because in the past there has been concern about the lack of consistency across the UK. But does the Health Secretary agree with me that this is a useful reminder that the pandemic is still with us and we all have a responsibility to get vaccinated, and that includes getting the booster?
Secretary of State.
So, first, I can tell my honourable friend that there's been excellent coordination across the UK on this. And as I mentioned earlier, that Scotland and all parts of the UK will be aligning themselves with what I have announced. But the importance of the booster programme, as I say, cannot be more important. In fact, the very latest figures are 28.5% of the UK population of the age of 12 has been boosted, by far and away more than any other country in Europe. I think second only to the United States. But it's still not enough. We need everyone to come forward. And if there are people out there listening that are thinking, what can they do? The single most important thing they can do is, if they are eligible for booster, go and get it. In fact, go out this weekend and make it your booster weekend.
Meg Hillier.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, I appreciate that the Secretary of State has come to the House at the earliest opportunity and his swift action, and I hope this indicates the way he will engage with us all on this vital issue. I wonder if he's had any indication from South Africa and the other South African nations of Southern Africa that he mentioned about the impact on children of this variant, and whether there are any plans to offer second doses to children here in the UK.
Secretary.
Madam Deputy Speaker, it's a very good question from the Honourable Lady. And first of all, I have to, at this point in time, this has moved so fast, we have not had any indications about the potential impact of this new variant on children in particular. It is something, as soon as we can find out, we will want to share. In terms of the UK, the child vaccination programme, it is going well across the UK. It's been building up a significant momentum. But as for whether second doses would be recommended, we would await for the expert advice of the JCVI.
Suzanne Webb.
Thank you, Madam Deputy Speaker. I welcome the swiftness of the government's response to this new variant under investigation. Can my right honourable friend confirm that as the situation develops, the government will continue to move at the earliest possible opportunity?
Secretary of State.
Yes, I can absolutely make that commitment to my honourable friend, and she will perhaps know already from the information the government shared. We only identified the significance of this variant just 2 or 3 days ago. And we didn't hesitate to take action because, as we've always said, we will protect our borders when it comes to this pandemic.
Lillian Greenwood.
Thank you, Madam Deputy Speaker. As the Secretary of State has reiterated, getting vaccinated is vitally important. I'm looking forward to getting my booster jab tomorrow. But he knows that some groups and some communities are more hesitant, more fearful about being vaccinated. And I'm really conscious both that vaccination rates in Nottingham City are below those in the wider county, and that our local health services are already under huge pressure. So can the Secretary of State set out what he's doing to drive up vaccination rates in areas where there's been low take-up? And will he now offer places like Nottingham additional support as we head into winter?
State.
Madam Deputy Speaker, I want to make sure all the support that is needed for our vaccination programme is there across England. And she asks the Honourable Lady quite rightly, what are we doing to reach out to those that have, for whatever reason, so far been a bit hesitant? We are working actively now for months with many community leaders. We have added many more venues and ways to actually receive the vaccine, so improved access. And there's significant work on communications and reaching out and making sure the right messages are there, and also people available, including clinicians, to answer questions. But she's absolutely right to point to the importance of this, and I'm pleased to hear that she'll be getting boosted this weekend.
Sir Christopher Chu.
Madam Deputy Speaker, ivermectin has shown promising results as a potential treatment for COVID-19, including in South Africa. Over 5 months ago, ivermectin was added to the Oxford University trial called Principle. When will the results from that trial be available? And what is the government doing to expedite the process? Because ivermectin may not be a magic bullet, but it may be.
Secretary of State.
Friend makes a very important point there. One thing that is different about dealing with this pandemic today than even a year ago is that we already do have more treatments. And my honourable friend mentions another potential new treatment. I'm afraid there's no exact date that I can share with him about when we think the trials will be over. But I'm pleased that these trials are taking place. He's right to point out the potential of this treatment. But I can reassure him that whether it's with ivermectin or other potential new treatments, the UK could not be more engaged.
Ruth Jones.
Thank you, Madam Deputy Speaker, and I thank the Secretary of State for coming to the House today to give us this statement so urgently. There were a number of high-profile sporting events due to have taken place in South Africa this coming weekend, including the United Rugby Championship, in which Cardiff and the Scarlets rugby teams are due to play. So what assistance has been given to them to get them home ahead of the midday deadline today? And also, what discussions has the Secretary of State had with the devolved administrations to ensure a coordinated, orderly introduction of the new travel restrictions?
Secretary of State.
Madam Deputy Speaker, I mean, first of all, I understand whether it's sports teams or the thousands of British tourists and others that are currently find themselves in South Africa, Botswana, or any of these countries. This is very difficult news, but I hope that many will understand. Indeed, I've had messages today from people that are in South Africa, and it's made their life a bit more difficult getting back home, but they fully understand and support the action that has been taken. As for her particular question around the team and what can be done to try and get them back before this deadline, nothing. We won't do anything to help them get back before this deadline, because I think anyone who's in South Africa, the best thing to do is to come back and after 4 a.m. on Sunday and go into hotel quarantine.
Mark Pawsey.
Thank you, Madam Deputy Speaker. May I commend the Secretary of State for the extremely prompt action that he's taking to protect our citizens. And while these are very early days, the Secretary of State himself has spoken about the uncertainty and that we don't know enough about the new variant. Does he have any assessment of how long the measures that he has introduced, as announced, might be necessary?
Secretary of State.
It is a good question, Madam Speaker, but I'm afraid that such is the uncertainty around this variant and the rate at which it seems to be spreading. I'm afraid it's not possible to put a timeline on this action.
Gareth Thomas.
Thank you, Madam Deputy Speaker. If we're to help reduce the chance of further variants emerging to threaten the health of our citizens, we need to clearly accelerate vaccination programmes in other countries, particularly in the Commonwealth. So why are ministers so determined to use the World Trade Organization ministerial meeting next week to block progress towards achieving, as South Africa and India want, a temporary waiver of intellectual property rules to help developing countries develop their own vaccine manufacturing capacity?
Secretary of State.
The answer to the honourable gentleman is because a temporary waiver of intellectual property for such purposes would be a huge step backwards. It won't help developing countries. It certainly won't help if we do need new vaccines, not just for COVID-19, but for a future pandemic, that industry and the business might step back and not bother developing if they believe that their intellectual property would always be waived in such circumstances. What is important, and I think the honourable gentleman would agree on this, is that the companies that are developing these life-saving vaccines have an appropriate pricing and access policy for each country. So if they are dealing with developing countries, that is priced appropriately in an accessible way, and countries, rich countries like the UK, the US and others continue to do all they can through international vaccine donation programs.
Philip Hollowburn.
Secretary of State for the swift action he's taken in relation to this new variant, and he's completely right that the booster programme is now more important than ever. But in the Kettering constituency, residents in Rothwell, Desborough, Burton Latimer, Barton Seagrave and Kettering are telling me of the difficulty they're experiencing in getting a booster within the Kettering constituency, and they're being asked to go to either Corby or Northampton, which for many people is very difficult. So can we have a boost to the booster programme in Kettering with immediately local walk-in booster centres?
Yeah. Secretary of State.
My honourable friend is right to talk about the ease of access to the booster programme. Of course, we want to make it as easy as possible. We are adding numerous sites day by day, but on the particular issue around Kettering, I will absolutely see what we can do. The Vaccines Minister has heard what my honourable friend has said, and if I can suggest they can have a quick meet after this, and I'm sure she's really eager to open up more access points in Kettering.
Kerry McCarthy.
Madam Deputy Speaker, I would echo what the Honourable Member for Kettering said. I got my booster on 18th of December, which a few days ago was the first date that was being offered near me in Bristol. But can I ask, there's a growing divide now between people who will have had 3 jabs and people who won't have been jabbed at all. What more can we do to persuade? I know there's some hardcore vaccine refuseniks, but there's also quite a lot of people that think that because they've had a mild dose of COVID, they're now immune, and particularly with new variants coming on board, we know that they could well be at risk. So what can we do to persuade those people that have not been jabbed at all that it's time to get jabbed?
Secretary of State.
The Honourable Lady is absolutely right. There are still too many people out there that are, let's call, vaccine hesitant. They're not complete refuseniks. They just would want more information, and maybe they've read the wrong type of information, and more needs to be continuously done to reach out to them. So if there are people in particular communities, we are working with community leaders. There's been a real change in our comms program, trying to reach out to people in different ways. For example, much more use of social media, and also through our general comms. If the Honourable Lady also has some new ideas and she thinks that we can try, we are listening.
Elliot Coleman.
Speaker, and can I also welcome the speed in which the government has acted. Many Carshalton and Wallington residents have contacted me before to raise concerns about people rushing to fly to the UK before added to the red list. So can my right honourable friend confirm that flights from these 6 countries will be banned until the quarantine is introduced on Sunday, and that the same policy will apply to any new countries being added to the red list in future?
Secretary of State.
Yeah, what I can tell my honourable friend, the decision to ban the flights, obviously it's a temporary ban, is to allow us time to stand up the quarantine system, the red list system, or what's called the managed quarantine system. And once that system starts and we are comfortable that it's functioning as we would like, then those flights that we would review that decision. And so if it comes to any other country, we would consider banning flights if for similar reasons as has been taken here that it's necessary.
Greg Smith.
Thank you, Madam Deputy Speaker. My right honourable friend is absolutely right to be taking these new variants as seriously as he is. But given the critical importance of avoiding the damage to children's education and development and the economic havoc more lockdowns would bring, if the news from our world-class scientists analysing our current vaccines' effectiveness against these new variants is positive, what assessment has my right honourable friend made of the ability to stretch the booster programme to bring it down through the age categories and to get it into more arms, potentially quicker than the 6-month gap as we head into winter?
Madam Deputy Speaker, regardless of the news around this variant, the booster programme remains absolutely crucial. And in fact, if anything, because of this news, as I said earlier, it's even more important. And my honourable friend asks about whether the programme may be extended to lower age categories. And as he knows, from this Monday, we extended it to the age group 40 to 49. That is something that the JCVI has already said that they are considering, and I await their advice.
Thank you. I thank the Secretary of State for having come directly to the House this morning. Order. Order. We return now to the Down Syndrome Bill. And as I just hesitate for a moment to allow people to leave the chamber, Tom Randall.
Thank you, Madam Deputy Speaker. Like many others, I rise to speak in support of this bill, and I'd like to add my congratulations, as they've been from across the House, to the Right Honourable Member for North Somerset on bringing this bill to the House, and for his passionate speech in favour of the measures that are contained within it. Down syndrome is a visible condition, and the name will be familiar to very many people. But I think what his speech did this morning was to actually raise so much awareness of a condition which, so many factors of which we are not actually members of the public, or those who haven't been directly affected by it, are not aware of. And I do find that this morning has been, as so many Sitting Fridays often are, a very educational process. And we've actually learned something, which I think, as politicians, is something it's good that we do once in a while, is learn something about the wider world. There are 47,000 people in the UK with Down syndrome, and I'm also very grateful to the constituents of mine who have written in advance of this debate today to talk about the issues that they face and that their families have faced, and the challenges that this condition can bring. They've spoken to me about how, on learning that the baby has Down syndrome, that the language and attitude it can often be negative and discriminatory, and that young people are currently more likely to be hospitalised and for longer than those without it. I've learned in my research in preparation for this debate today that those with Downs can have problems that include the heart and bowel difficulties and difficulties with hearing and vision and an increased risk of infection. So there is an increased requirement possibly on health services. That parents are often discouraged not to send children to mainstream schools because sometimes mainstream teachers lack confidence and the knowledge to include children in classes alongside siblings and neighbours, and that post-16 education is often a one-size-fits-all approach that sees learning stalls, and that social care can often be inappropriate. And I think the example that my right honourable friend gave about particularly those in older life is he's completely right to say that there is a disgrace, a scandal that we very much need to avoid, and particularly possibly putting those with Down syndrome in sort of age inappropriate settings. So this bill does, I think, have the opportunity to make life-changing changes for a condition which affects so many different aspects of life across the health, educational, housing and social care fields. This is a short bill. It's only a couple of clauses, and it requires the Secretary of State to create guidance, and various authorities will have a requirement to have due regard to that guidance. Now, one might argue, I suppose, is there a requirement for primary legislation for the production of guidance? We ought not to have sort of laws for law's sake, but I think given the sort of the plethora, the wide variety of bodies that this guidance will affect, I think that argument is very strong, and it's been articulated very strongly this morning, as well as highlighting the importance of the changes that can be brought about once that guidance is written and implemented. There is a precedent for this bill as well. We haven't spoken yet this morning of the Autism Act that was passed in 2009, which I think shares some similarities to the bill that's before us today. And I am particularly struck by the words from the National Autistic Society, who have said that the Act has brought about some great changes to the way that autistic people access support. They've said that because of the Act, almost every council has a diagnosis pathway for adults and a specific autism lead. And additionally, it makes sure that every autistic person has the right to a social care assessment, something that was difficult for many autistic people more than 10 years ago. So it appears that there has been positive changes brought about by that legislation. So I'm confident, I'm hopeful that by supporting this legislation today, we'll be able to revisit this situation in 10 years' time and see that we've seen great strides in the way that the needs for people with Down syndrome have been met, and therefore this bill, as I'm sure it does across the House, certainly commands my support, and I wish it well.
Nick Fletcher.
Thank you, Madam Thank you, Madam Deputy Speaker. And it's a pleasure to follow my honourable friend from Gelding, and it's a pleasure to be in here. This is my first sit-in Friday, and it's a completely different experience. It's lovely to see the House so collegiate, and it's fantastic to support my right honourable friend from North Somerset. Few private members' bill receives so much support, and the fact that this bill has done so is testament to how welcome it is. I have met some of the fantastic families that have campaigned on this issue too, and I know that this bill is a accumulation of the years of work that has gone into it. Over the past few decades, we have made significant progress in how we support those with disabilities to live fulfilling lives, notably with the Equality Act. However, the term disabled people refers to such a large and varied group that legislation for those with disabilities needs to be more targeted if it is going to address people's individual needs. We recognise the fact that the Autism Act, as my honourable friend has mentioned, that was a decade ago, and it is time we did the same now for those with Down syndrome. This legislation will help people with Down syndrome and their families receive public services that are suited to their needs in every interaction they have with local and national government, from job centres to social care. One area where this is particularly relevant is in education. The Down syndrome bill will allow parents to choose the best school for their children, whether a mainstream or special needs school, because wherever they attend, the local authority will have to ensure that education provided is adapted to a child's need. Since research suggests that children with Down syndrome have significantly better educational outcomes in mainstream schools, the legislation could have a transformative impact for some children. Social care for people with Down syndrome is another area that will see a change because of this bill. While social care has often been in the news during the pandemic, coverage tends to focus on social care for older people. Nevertheless, a significant percentage of people who require social care are of working age, and especially in the case of people with Down syndrome, their needs are different to those of older people in care. People with Down syndrome are living longer than ever, and that is a wonderful thing. But that does not mean that a care home for a 75-year-old man with dementia is suitable for a 45-year-old woman with Down syndrome. I am therefore pleased that under this legislation, people with Down syndrome will be entitled to age-appropriate social care. The bill will not solve all the challenges that people with Down syndrome face when interacting with government bodies, but it is hopefully a step forward that will lead to a marked improvement to this present situation. And once again, I commend my right honourable friend for getting this bill here. Thank you.
Alex Norris.
Thank you, Madam Deputy Speaker, and I'm very grateful for the opportunity to speak for the opposition regarding this very, very important bill. I commend the Right Honourable Member for North Somerset for using his precious private member's bill slot on this very important matter. I understand that this is his first success in 29 years through this process, so roll on 2050 for the next one. Now, the thing that he said, I mean, he said plenty, I think, that will have moved people watching and people in this chamber, but particularly the comment that I will reflect on now, and I think over the weekend as well, is that this is not a bill about a condition, but a bill about people. And where he went next, that it's not about charity but empowerment. That really struck with me, and I think that's really important, because we've heard of 47,000 people in this country living with Down syndrome, people across every nation and region, every constituency, and people with hopes and dreams who love and are loved, and people who have a right to live full lives and reach their potential. I think the Honourable Gentleman is making a major step in that direction with what he's doing today. And we've had brilliant contributions across the House from colleagues. I've tried to group them into some themes, but particularly that this is human rights legislation, as said by honourable members from North Antrim, Hackney South and Shoreditch, and from Stourbridge. The enthusiasm that I would very much share from the honourable gentleman from Dunfermline and West Fife and from Berwickshire, that this is for a Four Nations approach in this area in the years to come. And I thought particularly the contributions, very moving contribution from the honourable member for Broxbourne, but also from Mean Valley, from Buckingham, from Carshalton and Wallington, from Don Valley, about bringing constituency cases into here. And again, I think those colleagues have really brought the debate to life by reminding us that you can throw around statistics about tens of thousands of people, but each one of those is a single person and an individual with different needs and different hopes and different dreams, and ought to be treated in that way. But of course, alongside all those 47,000 people, that's tens of thousands of families, mums, dads, sisters, brothers and cousins who I know will have listened to the debate. My family is one of those tens of thousands too, so again, we have a special gratitude to the Right Honourable Gentleman, because this gives us an opportunity for a leap forward in terms of support available for people living with Down syndrome. I was born in 1984, and at that point, life expectancy, Madam Deputy Speaker, for someone with Down syndrome was about 25, and it's now into the 60s, so basically gained a year every year for my entire life. That is wonderful, and it shows the advances that we can make when we prioritise the human rather than the condition, when we're ambitious for everybody and don't define them by the challenges that they live with, because we know that with appropriate support, people with Down syndrome can thrive at school, can work, can marry, can live full lives. And we have to take every opportunity to remove all the barriers, to tackle stigma, to tackle poverty of ambition that holds back progress in this area, and this bill is a perfect opportunity to do so. So turning to the provisions of the bill, and I note that the Right Honourable Gentleman has secured the government's support, so passage is likely to be a smooth one. The bill provides Clause 1, Subclause 1 for the Secretary of State to publish guidance to relevant authorities to make sure they meet the needs of people with Down syndrome. That is a very powerful tool, and I look forward to hearing from the Minister the sorts of things that she envisages being part of that. And as part of that Clause 1, Subclause 3, there is an expectation on the Secretary of State to consult, and as other colleagues have said, that is really important. It must start with individuals with lived experience so they can tell us what change they need in their lives, what challenges they've had to negotiate, but also must apply to their families. I think it was the Honourable Member for Carshalton and Wallington who talked about the battle, and that is a common theme of all the stories of the families that I've spoken to and that we've heard today, is the battle often. And then beyond that, it's crucial that ministers talk to clinicians, to commissioners, to decision makers, and I hope the Minister will, I'm sure the Minister won't want to be prescriptive about a consultation today, but might at least set out some of the broader themes that are in it. The schedule of the bill highlights 4 areas that the Right Honourable Gentleman is seeking for guidance to be made, and I want to touch on these briefly in turn. Firstly, the National Health Service, and it is vital that healthcare services are responsive to and ambitious for people living with Down syndrome, and that they get world-class healthcare. And again, I think we can be very proud of the progress made over the last few decades. But we must make sure that we're as ambitious in mental health as we are in physical health, and that the progress that we've made in physical health can be matched in mental health too. So again, I hope that the Minister might reflect on that when she closes. And also to address the point on the NHS, it references clinical commissioning groups. Now, obviously, we have legislation going through this place, and we had remaining stages Monday and Tuesday of this week around the Health and Care Bill. So that commissioning landscape will change. I just wondered if the Minister might be able to tell us how the language will change in order to reflect that those bills are progressing at the same time. We'll give way.
Thanks. Just going back a step to what he said about mental health concerns, and I think it's really important that when people with disabilities and conditions such as Downs experience mental health problems that aren't necessarily connected to their condition, but it means that treatment can be far more difficult, and it can be quite difficult to identify that people are developing mental health problems. And perhaps this is more a question for the Minister, but I do hope that we can always bear that in mind when we're looking at how we treat people with Downs.
Well, I really am grateful for that intervention. It's a shared commitment and a shared ambition across this place to make significant advances in the mental health of the British people. And we know that one of the barriers is for people with the most profound physical health conditions, because traditionally sometimes those have been the conditions that have been seen, and we haven't looked beyond to evaluate the mental health aspect. So I hope that this is a really good opportunity to do that. On turning now to housing, we know that with the right support, people with Down syndrome can live semi-independently, so we must make sure that the right type of housing, sensitive to need, is available and distributed across the country. So I wonder if the Minister's made a baseline of assessment of where we are currently there and what we might need to do better. On education, colleagues have made very important points about it. Again, at risk of repeating more of the things the Honourable Gentleman said, but around education and healthcare plans, I thought those points were very well made and hopefully will have been heard. And again, what I took from his contribution was that these cannot be pro forma exercises. These need to be individual exercises that meet individual need. That's the purpose of having them. And then linked to that, around employment, we know that only 6% of people with a learning disability in this country are in employment, and I think we should aspire to do much better. Work gives purpose, independence, dignity. Work is part of the collective investment that we make in each other. So we want everybody who can be in work to be in work, and I think that ambition applies to everyone, irrespective of their challenges. So we need, I think, a full strategic plan on the active steps that we can take to show employers the benefits of hiring staff with learning disabilities, along with the support that can be offered to help facilitate. And it is a win-win, and this is really important that we understand this, that if we look at global studies, they show that workplaces hiring employees who live with Down syndrome, that they are very happy workplaces and productive workplaces. So there's really something in there. And just before I close, Madam Deputy Speaker, I just want to make a point about redress that the Right Honourable Gentleman made in his point. That is a very important and very live conversation in this country at the moment. To read across briefly, if I may, to the Cumberledge report and to the impact of sodium valproate and Primados, and on children who are born and exposed to those things, those families, in many cases, many decades later, cannot get redress without still expensive, long and very hard pursuit in the courts, and it's a system that isn't working. Now, it was a a recommendation in that report that a redress system should be set up to avoid that. That's not happened. The government haven't accepted that recommendation. That shouldn't be happening for them, and that also should not happen here. So I hope that through the proceedings of this bill we can do better for people living with Down syndrome, but also for others too. So there's a lot I'll have to give away.
Mr. Speaker, there is of course a great carrot for the government in producing a workable redress system, which is that if it is not fixed in this chamber, it may be fixed in another place. But I can assure him that one way or another, it will be fixed.
I am very grateful for that indeed. I'm not sure that that was a carrot as much as it was a stick, possibly. But I know that noble lords in the Health and Care Bill will be taking the same interest, and I absolutely share confidence in that sense. So just to finish, Madam Deputy Speaker, I look forward to seeing this bill in its next stages. We want to see gains made in the 4 areas in Schedule 1 of the bill. I would make the very important concluding point, particularly around social care in local authorities, that social care is distressed in this country, social care is underinvested in this country. So we have to, if there are new responsibilities, there must be new investment to come with that, and that will be points that we will continue to make at future stages. So it requires government commitment, which is good that we're hearing this today, but also for the resources to sit behind it. I hope we hear that too. Thank you very much, Madam Deputy Speaker.
Minister Gillian Keegan.
Thank you, Madam Deputy Speaker. And I also would like to congratulate my right honourable friend, the member for North Somerset, on securing the second reading of his private member's bill, the Down Syndrome Bill. My right honourable friend's passion to help address the challenges faced by people with Down syndrome has been unwavering. And I want to thank him and for all those who supported the bill, many honourable colleagues here today, for bringing forward a bill to address this. And also to all of you, all the honourable members, for their contribution. I've really enjoyed the debate. I too have learnt a lot, and it is such an important time for such an important debate. I also want to pay tribute to Sir David Amos, who cared deeply about supporting people with learning disabilities. He was arranging for us to have a cup of tea to discuss how we could work together to do this. Sadly, now this cannot happen, but I want today to also mark Sir David's passion to improve the lives of all those people with learning disabilities. Now, people with Down syndrome should have the opportunity to enjoy all aspects of our society and to have access to the services and the support that will enable them throughout their lifetime. And I wholeheartedly support the Down Syndrome Bill. Sometimes you are lucky enough to be in the right place at the right time, and this is one of those occasions for me, because my nephew, Joseph Gibson, is one of the estimated 47,000 people in the UK who has Down syndrome. Joseph is a funny and bright teenager. He loves his school, has a great group of friends, and is a huge football fan, supporting Liverpool, of course, and also his local team, the O's Leyton Orient. And most importantly, Joseph is happy and thriving. He's learning, he's developing, and he demonstrates his ability, not his disability, every day, as all young people and adults do with Down syndrome. But my brother and sister-in-law, Marcus and Sarah, have had to work incredibly hard to access the services that have made it possible for Joseph to develop his confidence and independence. And we've heard from many other families who have, and also I pay tribute to those who are up in the gallery today, how difficult they've found it, how much they have been fighting that battle. And I want everybody to know that this bill, our support for it, and everybody's support in this chamber, hopefully those battles will become a lot easier. I know that today people with Down syndrome are struggling to access the services that they need, and I've seen this with my own family. It is not right, it must change, and we will change it. I recognise that the legal duties and frameworks are already in place to ensure services are tailored to people's needs, but we know this does not always happen for people with Down syndrome and their families. There is a pressing need to raise awareness of the unique needs of people with Down syndrome and how they can be met, so that public authorities know how to meet their existing duties and so people with Down syndrome can thrive in the community. But this is exactly what this bill seeks to address. For the first time, the government will be required to publish guidance on the specific needs of people with Down syndrome and how to meet them. And the relevant public authorities providing health, care, education and housing services must have due regard to it in carrying out their functions. And this is a significant obligation on authorities. There can only be strong reasons for not following this guidance. And importantly, people with Down syndrome and their families will be at the heart of this. They will be involved with the development of the guidance, as well as those who are responsible for planning and designing these services. I believe the impact of this bill will be wide-reaching. It creates the foundation to ensure people with Down syndrome stay well, receive the right education for them, and to secure the appropriate living arrangements to support their transition into employment, their transition into their old age, and to help them to be a part of our society in the way that they want to. So why a bill that focused specifically on people with Down syndrome, and why now? Down syndrome is a genetic condition. Every person with Down syndrome is a unique individual, but they often face common health risks. Almost half of children born with Down syndrome have a heart condition. There is significantly higher risk of becoming unwell through infection, which can be life-threatening. And they may need also, and often do, additional support with their speech, hearing or vision. And evidence tells us that people with Down syndrome have specific patterns of development that are unique to this condition. Sadly, there is an increased risk of early onset dementia. The NHS recommends regular checkups to look for these signs from the age of 30. And also I'd like to acknowledge that mental health and physical health, of course, are two very different things, and we will very much look to focus on mental health of people with Down syndrome. In fact, our mental health strategy that we'll be working on throughout the coming months. And people with Down syndrome are thankfully living longer. This is not 1983 or 1984 when the Honourable Gentleman was born, where people with Down syndrome lived on average to 25 years old. In 2021, people with Down syndrome are on average living to 60, and I'm pleased to see that this is continuing to increase and the pace of increase. For me, it's clear that this bill is not about giving people with Down syndrome more rights or enhanced treatment relative to others. It is about ensuring that there is a level playing field so that they can access the services that they are entitled to in the same way as everyone else, and that their needs are understood so services will be developed to meet their needs. I fully recognise, with respect to redress, that despite the legislation, there may be still occasions where people with Down syndromes and Down syndrome and their family do not feel that their needs are being met, and there must be clear, accessible and fair processes for people with Down syndrome and their family to raise concerns. We want people with Down syndrome and their families to be able to resolve concerns with authorities directly, and these processes should be easily navigated and not at great cost for families. We're considering how the routes to redress are working for people with Down syndrome and whether they are delivering the outcomes they need, but it is essential that we get this right, and I do anticipate returning to this subject as the bill moves through the House. And this is a hugely important bill for all the reasons I have spoken about today. I recognise that providing the right support for people with Down syndrome is a matter which resonates across the whole of the UK, and we've had some contributions from other parts of the UK today. But the scope of this bill, I'm very happy to give way.
Thank you very much for giving way. I'm just wondering if the Minister would be in a position to open discussions with the Scottish Government, Welsh Government and the administration in Northern Ireland to make sure that either during formal meetings or more informal discussions that this is put on the agenda so that the information you have can be shared across the rest of the UK and the benefits of the bill shared also with those with Down syndrome and their families.
Minister.
Yeah, yes, I very much, I've had some of those conversations have happened, but I very much will continue those as well, because the scope of this bill today only covers England. But of course, health, care, education and housing are also devolved matters as well. So I know there's a commitment, though, to improve the outcomes for people with Down syndrome in Scotland, Wales and Northern Ireland, including through legislation. And I do look forward to working with other health ministers on this matter, and I know that they are committed to do that as well. I look forward to aligning policy, practice and the guidance wherever possible, so that best practice for social inclusion for all people with Down syndrome can be realised across the whole of the UK.
Just on that point,
Very happy to
be brief. I heard a lovely story a few years ago. A young man living at home but travelling to a daycare centre independently on a bus, did it for many months. And then his parents got a telephone call saying, we haven't seen your son for a month. Where is he? And they said, well, he's leaving in the morning and he's coming home in the evening. So the next morning they followed him discreetly, and halfway along the bus route, he got off the bus, walked into a builder's merchant, I think, where he'd got himself a job. Surprising, but perhaps we shouldn't be surprised. We should liberate these young people to make great decisions.
I completely agree. I mean, a number of honourable members have mentioned how important employment is to all of our lives, actually. I mean, it gives us purpose, it gives us structure, it gives us friendships, it gives us relationships. It's really important, and that shocking number of 6% is something we all have to work hard to overcome. And also not just Down syndrome, other learning disabilities. I think the number for young people with autism is 22%. Again, not good enough, and that's something that I very much hope to address in my role as Minister for Care and Mental Health, which includes learning disabilities in the brief. To conclude, Madam Deputy Speaker, we are working towards a more inclusive society for people with Down syndrome. This bill is one more step towards making sure that authorities are supported in delivering services that meet the unique needs of people with Down syndrome, so that this can happen also consistently across the country. Once again, I do congratulate my right honourable friend, the member for North Somerset, on this important work. I was very happy and glad that I was the government minister in place when he came forward with his private member's bill, and I am delighted to be able to offer the government's full support.
Speaker.
Dr. Fox.
Madam Speaker, if I may just say a few words in conclusion, and can I thank colleagues not only for their support, but the warmth of their support for this measure today, including my honourable friend, the Minister, who's helped throughout, has been invaluable. It's clear we have a united voice. It's clear that we have a united purpose. Now we need to have a united intent to make the aims of the bill a reality as the process continues forward. This bill will not be a panacea. No piece of legislation ever is for a particular problem, but it is a key tool. It is a vital first step forward. Although we still have challenges, as I mentioned, on the issue of redress, there is no point having rights unless you can demand that those rights are fulfilled in law. And it's also not just a bill about individuals with Down syndrome or families who have a member of that family with Down syndrome. It's also about who we are as a society. We talk a great deal these days about global Britain. Global Britain can't just be about diplomacy or trade or military prowess. It also has to be about our values. If we are able to complete the passage of this legislation before we get to International Down Syndrome Day on the 21st of March next year, we will be the first country in the world to legislate on this particular problem. And I think that would create the United Kingdom as a beacon for others in the world to follow. And after all, that is what global leadership is all about. We hold power in this place, but we also hold power to empower. People with Down syndrome are not supplicants in our society, but full citizens who have the same right to demand for themselves quality services in health and education and social care. We have heard today that on their own and through us, their voices are increasingly being heard. I urge them to use those voices increasingly. And I hope they have understood from both sides of the House and from all parties today that we will be right behind them when they exercise those voices and the powers that this bill may bring them.